Definitely a cataract surgery. So obviously it's a blend of both, not because of anything else. It's just that how much we can offer to our patients. So if we are checking more number of patients, that many patients we are trying to treat. So it gives us that satisfaction. And while operating, it's like, it's just that feeling of what you've learned all your life and that you're imparting it to the patient. So I think it's a blend of both.
Cataract surgery is meditation, but to reach to that stage, it's a lot of hard work. Then it becomes reflex and you're just enjoying the whole process. तो बहुत मजा आता है. और आपका जो पहले सवाल था ना, quantity quality दोनों important है.
Wow.
So many surgeries and a few but very good surgeries. I think that's the trick.
If you do not see OPD, you're not going to get cases for surgeries. So, and seeing patients in OPD also is, gives you a very nice feeling because you connect with your patient.
Yes.
During surgery, you're not really connecting. Obviously, you are operating, your focus is on the surgery. But when you talk to patient, you understand them, you make relations for life with your patient.
I think there are multiple verticals to this. Obviously, the product has to be really good because at the end of it, we are dealing with somebody's eyes. So it has to give results. It has to be cost effective. It has to be available easily. And the people who we are dealing with, of course, we need to have a connect with them as well. So I think it's many things that lead to my decision what I would use for a patient. If the person is not used to using that particular machine, however good it is, it may not give that optimal result. So I think if any new technology is there in the market, it's very important for doctors to be abreast to that new technology, and hence we have so many conferences. We have we have wet labs, hands-on training, so that when we are really using that technology on the patient, we are 100% sure what we are offering to the patient.
Unfair to name some technology that failed, but we can say why it failed. Either the company had too much of a fast growth में attitude आ जाता है, या तो उनका सर्विस बराबर से नहीं आ रहा है, or they're not able to reach tier 2 tier 3 cities में भी वही सर्विस आना चाहिए. If they are not penetrating the market deep, if there's not a horizontal vertical approach नहीं जा रहा है, तो definitely it's going to fail.
Technology is too expensive to afford for the surgeon, it will be difficult for them to offer it to the patients because they need to recover the cost from the patient. So this is why early on, and even now, there is resistance to adoption of femtolaser technology. Not everybody has femtocataracts. So it has to be affordable and it also has to give good results. So it has to have both.
What is my personal experience with BVI is that A is, of course, the connect with the people of the company is fantastic. So if I have to learn a new technology or a new way of introducing, say, a new lens, I know there'll be somebody who'll handhold me and who'll guide me through the entire my learning phase. So my confidence will increase. And if I am confident, I will be able to use it in the right way. So I see it as a very growing company and a company who I'd like to be associated for a longer time.
Your tagline is future is focus.
Yeah.
So y'all are a very future ahead thinking company, and not only are you bringing new things, but you're also training us so we know the optimal usage. जो भी आपने design किया है, I should be able to maximize that and use it to someone's benefit. So that training also which you impart, I think that's your USP.
BVI is not new for me. I have been attending international conferences since a long time, and I knew that BVI is a prominent company in Europe, at least, because many of my European colleagues are using BVI products, machines, and the phaco machines, as well as the intraocular lenses. Dr. Shiraz is a good friend, and he endorses BVI and uses all the lenses. So. And also the trifocal, the fine vision trifocal was introduced by
by BVI?
Yes, by BVI. I have done so many studies on trifocals and the different companies. And whenever I used to read papers for my discussion, there were so many papers on the trifocal from BVI. So I knew that this lens is a popular lens in Europe, and I was not really sure until a few months ago that it also is now available in India. And thanks to you and your team, who is doing a great job at introducing these lenses and going to different surgeons and giving them opportunity to use your technologies. And so far, I've had excellent experience with BVI lenses. The ISOPure is excellent, and also the fine vision.
We have been using lenses, and we have been using from different companies, But I think the first time a company has actually made this initiative of doing this kind of a podcast, which is obviously a little bit out of our comfort zone, but yet it is very, very exciting for us doctors. And we know that somewhere in our hearts, we always want to spread a good message. And we are rightly doing so through BVI. So we're very proud of this initiative, and I hope that this continues for longer.
We have so much knowledge to share, na? So why should we not spread the good word?
Yeah.
And we are the industry experts. So when we speak something, it's with a lot of scientific backing.
True.
So I feel that makes a lot of sense. If you have knowledge, you must impart it to the right
Totally.
audience in the right way.
Certainly, it's giving us an amazing opportunity and a platform to come forward and share our experiences, not only with the BVI or your lenses, but in general about ophthalmology, tips about eye care, and in general awareness about cataract surgery. Like in today's podcast, we discussed about some of the common myths which people have around cataract surgery. So I think it's a great platform, and you must continue this. And
Yeah.
I'm already associated with BVI. I've done few live surgeries using lenses, and I really wish you all the very best in your journey.
It's going to be probably the best company that we all will be looking forward to. So all the best.
I'm going to say BVI, always be very innovative.